from the esteemed invitees. It is about the aftercare services for all care leavers. How can we scale aftercare? Basically, Mission 2030. And I would like to call upon Farida, Lambay, co-founder Pratham, Girish Mehta, founder and director Care Leavers Inner Circle CLIC Forum, Geeta Gopal, co-founder and president of Future for Every Child, Dr. Kiran Modi, founder and managing trustee Udayan Care, and to moderate this session, I would like to call upon Shireen Vakil, head of Child Opportunity Fund, British Asia.
And should we have a break for 2 minutes or are we okay? Is everybody okay? Sanjay ji and Sanjay ji?
They can just go get it.
Yes. Okay. So we will try and make this a quick, not too long a panel. And I know it's the last session of the day and we're running over time. But we have very lucky to have a very good set of speakers with us. So this panel is about how we can take aftercare services to scale. So the issue is that we don't quite know how many care leavers there are, but what is it that we can do to make sure that over the next few years, actually every single child who leaves care can get good aftercare services. And actually, we don't know if it's 50,000, a little bit minus, a little bit plus, but that is an issue. But it's not such a huge number. You know, I was thinking as I work on issues of child labor, child trafficking, education, and those are in millions or tens of millions. So one has to grapple with it in a very different way. But 50,000 with the experience and the intent of everybody here from the government, NGOs, and corporates would make it really a doable proposition if we all put our heads together. So I'm going to introduce everybody. I think everybody is known, but I'll say a line as we go. So I turn first to you, Kiran. So everybody knows Kiran Modi here, who's the founder of Udayan Care, who has done fantastic pioneering work in this area. So what would you say, Kiran, is needed to take aftercare services to scale in such a way that, you know, as Geeta was saying earlier in the morning, that it is good enough, simple enough, and cost-effective enough, rather than using the word cheap, I suppose, but that it is, you know, affordable, let's say, enough to be taken across the country.
So first of all, I'm really grateful to CSA, UNICEF, and AFEC for organizing this much needed conference. We've been doing in our own way from 2008, you know, talking about the agenda of aftercare again and again. And now it is becoming a national conference. And the best thing is care leaders means care leavers who are turning into care leaders. Now they are taking the agenda forward. So I think that kind of a program where the care leavers themselves take up the cudgels, I think that's going to be the best. Otherwise, I think, you know, the collaboration between government, CSR, and NGOs, that's the best way. You know, CSR brings in money, and INGOs bring money. And also, NGOs have some expertise, and as well as when you look at resources, you know, the government has the wider reach. So without government, you can't work. So the three have to come together. And since morning, we've been talking about it, how it can be done. I will just quickly give a couple of small examples. I think small examples can make it even simpler to understand. Like, for example, we are working in Madhya Pradesh and Bihar and Telangana with the help of UNICEF offices there. And we have been able to work very, very nicely with the government and also bring in other funders. So we have been able to do, I think, kind of a sensitization about aftercare in the States, where we have been able to run some aftercare practices, aftercare training programs for the functionaries so that aftercare can reach to the wider audience.
Okay, I'll come back to you after to get some more concrete examples. But Geeta, if I can turn to you, and you talked earlier today, this morning in your presentation about effective aftercare solutions. So is there, what would you say were these effective solutions? And is there a shared definition of effectiveness amongst the key stakeholders in this area?
Actually, I think there is no shared definition, and that's something we should work towards. And I would like us in this space to set a standard for collaboration and collective action. I feel that NGOs, even if they work in the same space, create their own models, reinvent the wheel over and over again, don't collaborate. And I think, as we have seen today, this problem cannot be solved by any one organization. We need a collective. We need to share best practices. We need to share technology. If data is that important, let's share. And so much effort has gone into building database systems and data collection tools. Let's share that and really make it a collective effort. So I think we need to invest in bringing together the stakeholders in a collective effort. Yeah.
Okay, so you're saying there isn't any shared definition?
No, I think the example I gave of AFEC, Care, CSA, and Sevalia, to me is the first example of 4 organizations using the same shared definition and creating the same program. And I think we really need to grow that.
Right. Yeah. And that shared definition is?
That a program is effective. I mean, you have to provide a holistic set of tools, a holistic set of services, but a program is considered effective if a youth is able to get trained, get employed, and stay employed for at least 2 years, because our theory of change is that then they are prepared to live their life independently. There will be other support networks, peer networks, mentor networks, but they won't need financial support from some kind of service provider. They should be able to manage on their own after that.
Okay, thanks. The reason I'm asking, I came back to that is that one of the things to take something to scale is that you have to have some degree of consensus and some kind of agreement around a unified definition. So that is why it is really important, and as I heard this morning, from a CSA, et cetera, that we'd like to go out of this with a plan of action for going forward. So it would be good if that was a definition that we could agree on or people could build upon. But I want to turn to Farida, who is the co-founder of Pratham. And as you know, Pratham has been one of the organizations that has managed to work to huge scale. So coming to you, Farida, what do you feel are some of the key elements that need to be considered when thinking of taking something to scale?
I just want to reinforce what Geeta just said. If I would... Sorry.
Is it on?
Sorry. Thank you, Shirin. Thank you to the organizers. I just want to take up from where Geeta left. I completely agree that we need to have an agreed definition. And when you say agreed definition or a concept, we need to all agree on the basics. And if I would give you an example of 2 examples, and short one, Shirin. One is on child labor and one is on education. On child labor, when we started off some years back in Mumbai, we've been able to rescue or, almost 50,000 children. And we didn't do it alone. As Pratham, we had UNICEF and we had 4 or 5 organizations. And there also we had one simple definition that no child should work. No matter what it is, no child should work. And there were lots of semantics. People were talking about it, but UNICEF, we all decided that we will have no child under 14 to work. And that's how even the government came on board. So one is to have a very simple definition which is easy to understand. In terms of education, I must say that we've been able to scale up for 2, 3 reasons. And just now in India, we're working in all the states, right, with millions of children. And when we started off in Mumbai, and even now we were very focused as Pratham. We are saying, and I think everybody agrees, that every child should be able to read and write and read the basics. Whether he goes for PhD or whether he goes to which school, we are not worried. But once a child is born here in India and he is going to school or preschool, the least we can do is giving him the tools to read and write. And once you give him the tools to read and write, you open the windows and doors for him. And that's how we were criticized for that, for being very basic and being very preliminary. But I think we were able to stick to this, and today Asar is all over in the papers, and we are saying that it has worked, that children are able to read and write. Once we all agree that the methodology can be anything, but if your outcome goal is that every child in my community must be able to read and write, I think we've won it. And that's how we were able to do what we were able to do. And I'm not saying Pratham alone did it. Pratham has, even in terms of just now the Asar, we have something like 726 partners. So it's not easy, and you cannot work alone. I want to stop here. Maybe you can, I'll come back for other things, if you have time.
So Girish, you have started the Care Leavers Inner Circle. So what do you feel could be done to make sure that all care leavers can get the aftercare service? And how can we use maybe something like technology to go to scale?
Hello everyone. First of all, thank you so much for inviting me, and congratulations to everyone, क्योंकि ऐसा फर्स्ट टाइम हो रहा है आफ्टर केयर पे काम, और हम सभी ने पिछले 5 years में बहुत ज़्यादा काम करने की कोशिश की है आफ्टर केयर के ऊपर. और स्पेशली अगर मैं मेरी बात करूँ या आफ्टर केयर में स्केल की बात करूँ, तो कहीं ना कहीं अगर हमको आफ्टर केयर में काम करना है तो केयर लीवर्स को इनरोल करना ही पड़ेगा. मतलब बहुत नेसेसरी है, क्योंकि उनकी जो थिंकिंग है, प्रोसेस है, उसी से ज़्यादा जो बेसिक्स है, मतलब जो मैं बचपन से देखता हुआ आ रहा हूँ होम में और निकलने के बाद देखता हूँ, तो मेरी जो लर्निंग है, मेरी जो प्रोसेस है, उस वे में मैं ज़्यादा अच्छे से समझ पाऊँगा कि मेरे जो पीयर सपोर्ट्स हैं उनकी क्या नीड्स है, उस पर कैसे काम हो सकता है. तो इसी हाउ जैसे हम जब स्टार्ट कर रहे थे क्लिक, तो कहीं ना कहीं हमारे साथ हमारे मेंटर्स थे जो कुछ आज भी बैठे, जैसे मन्ना सर है, गोविंद सर है, तो उन्होंने कहीं ना कहीं साथ खड़े रहे. जैसे मैं कहता हूँ एक चीज़ हमेशा कि अगर आपको स्केल करना है या ग्रो करना है तो आपको गाइडेंस की रिक्वायरमेंट नहीं है, कोई ऐसा मेंटर चाहिए जो आपके साथ खड़ा रहे और आपकी मदद करे. मतलब हमें आपकी कोई मदद नहीं चाहिए, हमें आपका साथ चाहिए, जो एक सही दिशा दिखा दे, वो एक हाथ चाहिए. तो वही मैं इस आफ्टर केयर में ही बात कर रहा था कि अगर हमें आफ्टर केयर को स्केलेबल बनाना है तो सभी को एक साथ कोलैबोरेशन में आना पड़ेगा. क्योंकि कहीं ना कहीं जैसे गीता मैम भी बात कर रही थी और सुबह भी कह रहे थे कि ये जो केयर लीवर्स की प्रॉब्लम है या आफ्टर केयर है, इसको सॉल्व किया जा सकता है आई बिलीव विद इन द 5 या 10 years में हम इसको सॉल्व कर सकते हैं. बस सबको कोलैबोरेशंस और थोड़ा गवर्नमेंट का सपोर्ट और केयर लीवर्स लीडर्स आए और मिलके सॉल्व करें, तो इसको हम सॉल्व कर सकते हैं. और रही बात टेक्नोलॉजी की, जैसे सुबह भी टेक्नोलॉजी पे बहुत बात हुई और मैं खुद भी बिलीव करता हूँ कि टेक्नोलॉजी होना किसी भी मॉडल में बहुत नेसेसरी है, क्योंकि इफेक्टिवली आप इंडिविजुअली एक पे इजीली काम कर पाते हो और एक चीज़ पे आप ट्रैक कर सकते हो. जैसे कॉर्पोरेट में एक चीज़ होती है कि आप लीड कैसे मैनेज कर रहे हो, तो हमारे केस में केयर लीवर्स की आप जर्नी कैसे कैप्चर कर रहे हो और कैसे लीड कर रहे हो. तो उसी से अगर हमको आफ्टर केयर को एक स्मूथली ट्रांजिशन करना है तो हमको एक स्केलेबल भी करना है, तो टैग को इनरोल करना पड़ेगा और इंडिविजुअली केसेस हम मैनेज कर पाए. ये मेरा थॉट है. थैंक यू.
Thank you. No, that's a very good suggestion. And I think the IDFC CEO had also talked about building a tech platform that could connect everybody, and I think that would be a very good idea. Another thing that struck me from the whole day's conversation was the real, especially from the care leavers who spoke, was the importance of mentoring. And if that is to be taken to scale, besides, of course, other things, but I know you've also, Kiran, done a lot of work on mentoring. And in fact, one of the things that struck me when I first met you and came to the Udayan Ghars was the fact about how you talked about, you know, them being mothers in the sense of as we would be parents to our children, that in a sense you never leave them. Now, when you take it to scale, it has to be time bound in some way. But how would you take that aspect of mentoring to scale? And of course, anything else you'd like to speak about?
I have a wild idea. I've been talking about it, I've been thinking about it, and I think it is doable. In Udayan Care, we have a mentor-parent system, people who commit themselves for life, and we are all there, 33 parents had joined, and now there are 29. So the rest are not there because the maker called them. So they've been there for 25, 28 years. Children come to us continually and grow up, and we are still there. Then they get married, we are still there. This kind of a model is very difficult to scale. But something which is really scalable, in UK and in many other parts of the world, there is something called PA, personal advisor. Why don't we have personal advisors? There are only social workers. Of course, there are program officers, and program officers, like, CSA has been saying, and like Udayan Care also has, very, very dedicated people. But they also have their time in an organization. They also move on. So children lose that, that trust, that आप आए और आप चले गए, मेरी बात सुन लिया, सबको report में लिख दिया और हो गई बात खत्म. So the children also need. So what I've been thinking, our Prime Minister also spoke once, that all the IS officers should start mentoring. So why can't DMs, under them, all the departments are there, and get every department head to mentor at least 2 to 3 young people at the age of 18 when they are coming out. Make them put them into different departments for 2 months, give them exposure, give them little bit money so that they can, commute. And the rest of the money, the organizations who are looking after them will be managing, and the state aftercare fund will come. Imagine, if and I have experienced, because in our aftercare outreach program, we have taken mentors from Delhi University, we have taken mentors from CWC, and all kinds of, and they've been saying, I've been in CWC, I was passing hundreds of cases on a daily basis. But when I started mentoring, the kind of joy it gave me, the kind of understanding it gave me, it's beyond compare. So I think this is one thing we should really talk to the government. Secondly, like we've been talking about, if the care levers take the agenda, nothing can be better than that. All of them are demanding a seat on the table. We have been talking to Madhya Pradesh government as well as in Bihar government in all your district convergence meetings. Allow 2 care levers to be there. Let them also understand what are your problems. Let them hear from you, and let them also express themselves. I think this will be the best thing to do. The kind of confidence it will give them, the kind of exposure it will give them, I think we really should pitch for that. Yeah. Thank you.
Okay, thank you. I think that's a really good idea. And I think if maybe when we open the floor, the people who are here from the government, there were people on this panel from Karnataka, Madhya Pradesh, that is something that if government officials themselves, whether it is the DM, we have how many districts in India? 650? So from each district, Haji? Approximate 700. We can have mentors from different walks of life, but especially the government, and mentors as overall mentors, not just skill counseling, etc. I think that's a separate thing which is of course needed, but mentoring, as was discussed, and I think that you could take this forward a long way. And on that front, are there any aspects, any sort of policy gaps that exist within the aftercare scheme that need to be looked at in order to take to scale? Farida?
Yeah, more than the aftercare scheme, once again, I won't talk so much of the aftercare policy, but I want to take another angle. This has worked, this mentorship, in education. Means the Honorable Prime Minister himself in Gujarat, he made a circular to all the officers that they must go and inspect all the schools. So everybody under the sun went with in the schools for the Gunotsav. It was called Gunotsav. And it of course didn't happen fully, but at least it started. So I think one thing which we, and again it's not a wild idea, but it's partly a wild idea, that just as you have Sarva Shiksha Abhiyan and you have the new education policy, everybody is talking about foundational literacy, in every, I think something on aftercare we should have a mission that, you know, we are looking at caregivers being rehabilitated. We can, you know, coin a different tagline, which I think all of you are very creative, but we must do something like that. And that will work, both with the government and with people like us. Secondly, I just want to say, is in terms of the gaps, it's not so much the aftercare policy, but it's also the societal gap. I feel somewhere, means I was not here in the morning, but looking at communities and looking at parents, what part do they play in, and especially in Indian communities, that how do they think of these care leavers when they come to the community? Are they accepted? Are they not accepted? What is the entire psyche of parents, not only for their own children, but everybody, and we have seen it happen. So I really feel one kind of a messaging for all parents, all communities, like we've done in education. We are saying, don't leave it to the government, don't leave it to the teachers. Parents are equally responsible. So you must be able to find out from your school what your child is learning. How can you keep on blaming somebody else when you don't go to school? And that has worked. So I think today's parents was different than I started my career. Today's parents is about 25-year-olds, 30-year-olds. They've all got primary education, secondary education. So they are much more aware, digitally aware. They are using smartphones. So I would say that we should take that group. And finally, I just want to say that digitalization, which Girish said, is very, very important. Not only in terms of dashboards, but even communicating messages. For example, just now, ASR reports are showing that 86% of boys and girls all know how to use a smartphone, and about 65% of them possess their own phones. So if we can optimize this now, and most of them are using the phones, one for academic and one for social. So if we can optimize these findings and use this for our care leavers program, I think it will be huge. And finally, on preventive note, again, and I'll stop here, Shirin, I promise. 15 to 16 this age group, ASR report is also showing, we also know that about 7.5% boys and girls in the 15 to 16 age group are out of school or not enrolled. Now, if this is the group which ultimately gets into institutions or whatever, children in conflicted law, some amount of, I know this is not we are not talking about prevention today, but I think this is also a group that we should optimize. Thank you.
No, thank you. And coming, Girish, आपका ख्याल में कुछ है जो policy में कुछ gaps है that need to be addressed from a care leaver's perspective that the government needs to address in terms of the policy?
Yes, I think policy में जैसे एक मिनट सबसे पहले JJ Act में अभी हमको जो realize होता है कि एक CCI living certificate एक add on करना चाहिए कि जो भी बच्चा निकलता है या care leavers निकलते हैं उनका एक सर्टिफिकेट उनको देना चाहिए. जैसे फॉर एग्जांपल महाराष्ट्र 1% रिजर्वेशन दे रहा है फॉर द ऑर्फन्स, तो कहीं ना कहीं अगर केयर लीवर्स भी अगर निकल रहे CCI से तो उनको भी देना चाहिए. मतलब CCI सर्टिफिकेट के थ्रू उनको ऑर्फन सर्टिफिकेट देना चाहिए जो बिल्कुल ऑर्फन है. और दूसरा जो ऑब्जर्वेशन वाले जो बच्चे हैं स्पेशली मेरा उसमें ही बहुत फोकस है कि उनके ऊपर कोई भी आफ्टर केयर स्कीम बनी हुई है बट मोरलेस उनको फोकस रखते हुए जो एक स्कीम बनानी चाहिए वो हमको बहुत फोकसली करना चाहिए. और जो तीसरा जो मेरा पॉइंट है कि अभी जैसे आफ्टर केयर में हम 4,000 रुपीज़ की बात करते हैं कि 4,000 रुपीज़ मिलेंगे केयर लीवर्स को, maybe that amount can be increased at least 8,000 या 10,000, क्योंकि वो 8,000 4,000 लाख की बहुत स्टेट में मिल नहीं रहा है, बट एटलीस्ट अगर कुछ स्टेट में मिल रहा है तो वो अमाउंट इंक्रीज हो सकता है, क्योंकि जो मेंटल हेल्थ इश्यूज़ है या कोई फाइनेंशियल क्राइसिस है, एजुकेशन इश्यूज़ है, वो सारे सॉल्व हो जाएंगे अगर हमको फाइनेंशियली थोड़ा बहुत सपोर्ट मिल रहा है तो. That's my point. Thank you.
So I suppose that should come in that sort of common definition of how much, I think you had said 85,000, but I don't know over what period it is. But what would it take? Because the important thing is to have a balance between giving the young people the support, but also making sure that they're self-reliant and, you know, self-dependent, as it were. So I don't know if you have any thoughts on that, Geeta. And the other issue I wanted to talk about that came across the whole day is the question of data. Because unless we actually know how many children are in the system, have left the system, how can we plan both financially and services? And secondly, they're extremely vulnerable. We don't know where they're going, girls and boys. And we know that if they're so vulnerable, then they'll be prone to various forms of exploitation, right? So in a sense, even from a preventative mode of preventing exploitation of different forms, whether it's sexual exploitation or trafficking or anything, it's really important to have that data. And I think even if the states that are in this room, the governments, if they could collect that data, it would make a big difference. But over to you, Geeta.
Yeah, you asked about how much money is needed. And I think in all of our programs, you know, Kiran can also talk to it, our focus is on early employability. Right. You know, you don't want, I mean, care leavers generally, many of them, some do, but many of them don't know what they want out of life. There is not much point in just like going into a degree when you don't know if that's what you want. You're just postponing the problem. You know, at that point, they have to figure out what, you know, how to get employed. So I think our focus is on employability, and therefore, and then they're free to study further or free to study while they are working. So therefore, the cost is not that high to train them enough to get them employable. And I think that's been our focus, is provide them vocational skills. In some cases, they're very focused on what college degree they want. That's great. But in most cases, provide them some vocational skills, get them working. The self-confidence they get from that first paycheck, from being able to support themselves, is just immense, and it helps. So I say 85,000. I mean, that's been the cost over the 5 years.
Over that 5 year period.
Over the 5, no. It's the cost per care leaver that we have measured in our program over the 5 years. Yeah, it's the total cost per care leaver. Sometimes that cost...
Per care leaver, but for how many years?
For the total program. It's from enrollment to when they finish.
To when they finish.
Yeah, when they finish studying, including mentoring. And its average cost over all the different types of courses they do. So it's just, if you invest 85,000 per care leaver, you can really take a whole group of them and
make them self-reliant so that they're okay.
And also, I think Kiran has a lot of policy.
Go on. Yeah.
Actually, you know, your question was, what are the policy gaps? I think we should look at it in this way. I think Indian policies are really good. Compare them to anywhere in the world. Our policies are great, but the problem is we are not applying them properly. That's where the biggest problem is. If all of us advocate for at least implementing the policies which are already laid out, I think most of the problems can be resolved, rather than setting up still new policies. For example, guidelines. Of course, you know, it is a state subject and all the states are coming up with it. The last I counted was 13 states have their guidelines, which is really not much, but still 13 states. But every state is going their own way. So if there could be a national guideline, and in fact, if you remember, UNICEF and UNICEF government has invited us in 2015-16 to make a national guidelines for aftercare. Yeah, but where it is, I don't know. But now I'm so glad to see that there are so many policies which are guidelines which are coming up. But each guideline, they really need to think about, like Mission Vatsalya, it talks about any form of alternative care. Children who are leaving any form of alternative care. Today I heard for the first time 2 states saying that they are giving to alternative care children who are also coming out. But in my experience, I have not found anywhere other than the care leavers coming out of institutional care who are getting it. Like for example, in Gujarat, we are working so closely with PMPY, you know, Palak Mata Pita. At the age of 18, you don't get anything. And I mean, your relatives with whom you are staying, they are not able to look after you. You know, so there are so many gaps there. In application, it is written there in the Mission Vatsalya clear. Any other form of alternative care, please, you know, specify, make it clear. Wherever there are cobwebs, make it clear, make it very, very simple for everyone to understand. Similarly, orphan, you know, JJ Act also says orphan does not mean actually both parents dead. You know, so we have to think about what does this orphan mean. Children are not getting admission into good schools. We have been able to manage because of our personal, you know, connections with the principals. But EWS quota, we don't get for our children because who is going to declare them orphans? But there is no death certificate. They got lost and then they landed up in this system. So there is no, you know, they will never get EWS. They will never get PMJ. It's very easy to say that they should get PMJ, but how? You know, because it's asking for all kinds of things. So simplify these things. Similarly, you know, housing. It's a big, big issue. I think all state governments must take it up, and housing at a lower rates for care leavers who are coming out should be available. Now it should not be institutional care, aftercare home you set up and there, you know, after one institution, another institution. Another thing, I like what he is saying that make it 8,000, 10,000, but at the same time, please think, if you are getting 6,000, I know at least few children in Gujarat who are getting 6,000, and we've been able to get them very good jobs. They're not taking the jobs. Why? Because the moment they take the job, the government funding will stop. So they are saying, okay, I will educate myself, give me money for education. So this is the problem, you know, we should not become crutches in their lives. We have to think of schemes by which we are encouraging them to stand on their own feet the soonest. That will be our biggest service, I think. And care leavers networks, of course, you know, and one thing which is desperately needed is, you know, DEI. Vandana also spoke about it. We really need to think, you know, children with LGBTQ community, disability, where are they going? We saw with our own eyes many, many children lying just like that with not even, you know, this locomotor movement kind of toys, you know, to make their hands work. So what are we doing? And no speech therapist, no tie-up with, next door there is a, you know, hearing impaired institute, but there is no tie-up. I mean, these are the things that we should be looking at. And even though the JJ Act and the Mission Vatsalya continually talks about, you know, convergence, collaboration, coming together, when are we doing that? So instead of racking our brains on what else can change, let's rack our brains how the policies which are already there can be implemented.
Thank you, Kiran. I think that's a very good point. And I think that it would be really good to have that, at least in the states that are already present and are already working, but then to actually take it on to other states. And perhaps since there was a move for national guidelines, maybe that is something that with UNICEF can be taken forward based on good practice from many states that are present in this room. So just before we wrap up and just take some questions, just as a last, as any last points, especially in terms of, you know, taking things to scale, you know, and alongside what we need to do as a group. And I think we have talked about coming together and networks, etc. And there are various networks, even of care leavers, that are still in this room. How can we all come together to take things forward? Just quickly from each of you.
No.
I need to catch a flight. Can I just take 2 minutes? Sure. Go on, Arlene. You can, yeah, introduce yourself.
Sorry about this. No. First of all, congratulations on an excellent workshop, conference, bringing all of us together. I'm going to really rush. Just some policy gaps and recommendations for perhaps law reform. The definition of aftercare itself has to change. It should not be a child who completed the age of 18, because there are so many children who are less than 18 who leave CCIs and who are slipping through the cracks. Secondly, in terms of registration of childcare institutions, could it be a clause when you're getting registered as a childcare institution, your systems need to be in place to ensure that you're connected to aftercare programs. So if a child enters through this door, when the child exits through the door, there has to be a pathway to reintegration back into community. A cadre of, just like CSA has paid program officers, can there be paid program officers? Because our DCP units, I think all of us know, are not in a good shape, and our protection officers and outreach officers, the quality of SIRs are bad, the ICPs are non-existent, and therefore rehabilitation at the time of exiting an institution is really meaningless when you don't have the pipeline in terms of ICPs and SARs, and therefore a cadre of program officers, just like CSA has, the system needs it. Peer group homes, I don't see that it was mentioned by a couple of people, but the concept of a peer group home for independent living skills, it's come in our Karnataka rules in 2002, but I don't see that so much in. The thing is with children in CCIs, I believe, I don't know what's happening over the past few years. Just this morning, I spoke to a care leaver and a mother of children who are in the system, and apparently children are not allowed to go back home during the holidays. There is a very strict rules. We want children to be connected to their families and build these relationships so they can go back. Why are we locking them up?
It's a must.
No, I think that varies, but go on, Arlene, so we can come
that's
back
one.
to the panel.
I think last year it was, Halima ma'am, you may remember, with Government of Karnataka, I had done some comparative research on the Udayancare model, you remember, with Prerna model of aftercare guidelines, and We Live and others who are actually running programs for aftercare, because Government of Karnataka wanted to build 6 homes for girls, aftercare, not homes, but rehabilitation programs for girls. Some thinking, a lot of hard work has gone into that. But maybe it needs to grow from there. I don't know what has happened to that. But in terms of models, replicable models for programs with funding, with standards, with principles, etc., if that can be developed further. I also want to have perhaps something for CSA and AFEC to think about. I had a lovely conversation with Anusuya this afternoon over lunch. And my question is, we're always talking about scalability. But it sounds a little corporate to me, because there are many kids who are falling through the cracks, and you're going to then pick up only the kids who you know are going to succeed. I'm sorry, I don't want to make an allegation like this. Yes. I don't want to sound like that, yeah. But I think to a certain extent, what I'm saying is, my question rather that was early in the morning is, what is our admission criteria? And what is our exclusion criteria? And there are many girls who I won't say I'm mentoring, but informally enfold, and even in my personal capacity, we are desperately trying to get some kids who don't fit into any kind of a program. I think Ramya will stand vouch for that. There is one girl who we have finally got into We Live, who was really won't fit into any kind of a criteria. So what happens to CSA and your work with kids who may not really reach the success rate that you're looking for? And the last point is that such wonderful work that CSA has done, AFEC has done, and everyone in the I make a recommendation for a policy brief to be prepared for drawing on all the wisdom that Udayancare and all the other organizations working on it, but more from a scientific point of view with the models that have come up for and aftercare for both policy reform as well as implementation. Okay, thank you so much for giving me that.
Thank you. Thank you for all your good recommendations. Okay, so we just have a quick no, I'll come back to you, because then otherwise we'll go into, that's good, thank you. But you can respond when we come. So just very quickly, starting from you as the only, since we male on our panel, we'll give you the first word.
Okay, I have 3 just short 2 takes. First is like, अभी AI का ज़माना है, तो हम भी इसको यूज़ करते हैं, और मैं भी बहुत अडॉप्ट करता हूँ इसको. क्यों ना हम सब मिलके एक AI chatbot लॉन्च करते हैं मिलके, especially for the care leavers, including the helpline number, kind of a national helpline number for the care leavers, where any care leaver can reach out और कैन चैट विद अस फॉर हेल्पलाइन नंबर फॉर द सपोर्ट के लिए, जहाँ हम सब मिलके काम कर रहे हैं. वी कैन थिंक लाइक CSA कैन स्किलिंग के लिए सपोर्ट कर सकता है, उद्यन के में भी थिंक उसको कोई डॉक्यूमेंटेशन के लिए सपोर्ट चाहिए, या स्टेट के अकॉर्डिंग हम सपोर्ट कर सकते हैं. ऐसा हमको मिलके प्लान करना चाहिए. दैट्स माई थॉट एंड आई विल डू इट डेफिनेटली. थैंक यू.
Thank you. That's a good part. I'll come to you. I'll come to you.
No, I just, I don't want to repeat what Pratham has gained out of many years is data. So, and very, very sure about our data. And all actions are data driven. So I think that is what we need to do even in this space. I know it's more qualitative, but one can move around it. And lastly, I want to say that we have a skilling program model in almost all the states where we take, we give skilling to boys and also have placements with good partners, and they've been game changers. So I could share the skilling program for with every state, and in that state one can easily do the collaboration. Yeah.
Thank you. Kiran.
When we talk about data, I don't understand why we don't have data. Madhya Pradesh is sitting right here, and we were so pleasantly surprised when we asked you for data of the care leavers, and we got such neatly compiled data of care leavers, and that really gave us the wherewithal to connect with them, and YSS was born. You know, the care leavers network, which MP government is going out of its way to promote. Even Juvenile Justice Committee has mentioned that. Recently we did a conference in Delhi, and one of the CWC members, because again and again this data question was coming up, she said, why don't you take out an RTI and immediately you'll get all the data. You know, so it is not possible that the state governments don't have the data, because every child who leaves an institution, CWC passes an order, and it is in a register. Of course, those registers you just cannot manage, because we tried at least in 10 CWCs, everyone had a different format. I think UNICEF had also taken up this responsibility to develop a format. You remember we spoke about it 3-4 years back. You said we are working on it. So data is available. All we need to do is to pressurize government to release the data. Data does not mean that we want everybody's name, email ID, father's name, mother's name, what they are doing. No. But this year, how many children are coming out of your institutions? Why can't you say? I mean, you have the data, right, sir?
Okay, thank you. So we can give someone a responsibility to get that data for sure over the next period, because you're right, it should come. Geeta.
Yeah, I want to address one thing that's somewhat lost in all this talk about government stipend, government funding. If you look at CNCP from up to the age 18, the government has a regulatory framework, but the CCIs are almost completely run by NGOs who are funded privately or through CSRs or whatever. I think we need to bring money into the aftercare problem, not just say the government is going to fund it. We need to make this an area, first of all, awareness. You know, in the US, whenever I talk, people are not even aware of that there are these children who come out of institutional care at 18 and are supposed to just fend for themselves. It's the same thing that happens with foster care in the US also. So there's raising awareness and then creating a program that has measurable outcomes that show that the money is being used really wisely. Then you can bring foundation money, private donor money into it, and I think we really need to make an effort.
Okay, thank you. No, those are all really good points. And I think that you've made a start, and I think it's a really good start with CSA, UNICEF, and yourselves to pull together some of the learning, but probably that needs to be you know, consolidated further. And I think before I just take some questions, for taking things through scale, there are lots of elements, but some of the key things that I thought I just wanted to put, and everyone has covered it, is, you know, building consensus. So making sure that we all, especially the key people who are working on this issue, come to a common definition, of course, of aftercare itself, but actually what is it that is required, whether it is 2 years of employment or group housing or, good mentoring, simple, not too much. We can't make it too much, but we should all agree to it so that we could present it going forward. The other is building coalitions and networks, which I think is really important. And we already have care leavers networks, but how can we make sure they all come together and have some kind of also mentoring? I think that's a really good, it may be a wild suggestion, but those are the ones that make the change in the end. But building those coalitions and partnerships, unlocking funding, that is really important, whether it is government funding or corporate funding, and building capabilities to be able, so whether it is what Arlene was saying, that the program officers, can you have that sort of, in the district child protection officers to have those capabilities that are required, and the data, because without the data, I think, that you can't actually see what level of scale and how much you want to go to. So I think that whether it is an RTI in each state or at least in the 13 states where the three of you are working, you should make sure you get the data of the care leavers. Okay, so, but thank you very much. That was, very good and rich discussion, and I'm sorry if I hurried each of you. But if anyone has any questions before we close. I know, he wanted to ask and I said
so, we've been told 2 questions. Yeah. So he gets 1 and there's 1 more.
Question नहीं है, suggestion है.
I'll take 3. Okay, go on.
2-3 सजेशन है मेरा बस. जैसे गिरीश ने बोला था कि हमारा एक वेबसाइट होना चाहिए जिसमें सारे यानी भारत के जो भी केयर लीवर कनेक्टेड हो. तो सारथी जो अभी नेशनल केयर लीवर नेटवर्क है वो ऑलरेडी वेबसाइट पे काम कर रहा है और अभी हम लोग कुछ दिनों में लॉन्च करने वाले हैं. तो मेरे को लगता है कि अगर कोई स्टार्ट कर चुका है तो उसको हम दोबारा ना करने के बजाय उसी को सपोर्ट करें, है ना, क्योंकि फिर ऐसा होगा कि डुप्लीकेसी हो जाएगी कि आप जो केयर लीवर है वो भी कंफ्यूज हो जाएंगे कि मैं इसको ज्वाइन करूँ या इसको ज्वाइन करूँ. तो आपस में हम मिलकर कोलैबोरेट कर सकते हैं अगर कोई इंटरेस्टेड हो कि हाँ इस पे काम करना चाहिए. जैसे अगर आप कह रहे हो कि डाटा कैसे कलेक्ट होगा, तो बहुत सारे केयर लीवर नेटवर्क है अलग अलग स्टेट में है, तो हम उनको क्यों ना सपोर्ट करें. दिल्ली में है, दिल्ली के नेटवर्क को क्यों ना सपोर्ट करें डाटा लेने के लिए, क्योंकि सारा डाटा तो नेटवर्क में ही आने वाला है. अगर आप नेशनल का डाटा लेना चाहते हो तो एनसीएल को रीच आउट कर सकते हो. तो ये सब सजेशन है मेरा.
ओके, थैंक यू. सो सेकंड क्वेश्चन, या go on.
Yeah, so these are just few suggestions. We should also think about looking at the children in need of care and protection because we're focused on aftercare, yes, because there are a lot of children like the ones we work with, Adivasi, Vimukta, Gumantar, NT, DLT, Adivasi children who can't get care and protection because they don't have documents to start with, and then the leaving documents. So it is a bit more complex. We have to look at the child in the 18-year also. I think most of us are, but that's also important because it's not just aftercare, because the numbers come down there, but the demand for attention into care and protection from the perspective of Dalit Adivasi, because that is an important subset.
Okay,
it is not coming in, and the diversity has to also be retained in the solutions that we make, and inclusion, gender, LGBTQ, caste is an important issue where aftercare care leavers, if we do a study, that would provide dismal picture. And just I'm using this thing to ask, Tamil Nadu has the highest number of children in the CCIs, so CSA should start working in Tamil Nadu also.
We have Sevale already working in Tamil Nadu.
Go on.
मैं ही ना, सॉरी. सो या मेरा सजेशन भी है और थोड़े से मैं अपने पॉइंट्स भी शेयर करना चाहूँगी जैसे एंड होता जा रहा है. तो फर्स्ट ऑफ ऑल तो मुझे बहुत अच्छा लग रहा है कि नेशनल कॉन्फ्रेंस थी और इतने सारे लोगों को सुनने को मिला, चाहे वो तमिलनाडु, महाराष्ट्र से हैं या कहीं से भी हैं. और मेरी भी नॉलेज बहुत ज़्यादा बढ़ी कि किस तरह से अलग अलग स्टेट्स में किस तरह से ऑर्गेनाइजेशंस काम कर रही हैं और हर ऑर्गेनाइजेशन अपने तरीके से एक अच्छा स्केल करने की कोशिश कर रही है केयर लीवर्स की लाइफ में. मैं खुद एक केयर लीवर हूँ और जब मुझे ये सब पता चल रहा है तो मेरी भी एक अवेयरनेस हो रही है कि मुझे आई गॉट टू नो कि इतने सारे ऑर्गेनाइजेशंस काम कर रहे हैं इस पर. तो मैं भी एक ऑर्गेनाइजेशन रन कर रही हूँ अभी. तो मेरी जो ऑर्गेनाइजेशन है क्लिक है, जो गिरीश के साथ मैं रन कर रही हूँ. तो मैं भी थोड़ा सा हाईलाइट्स करना चाहती हूँ कि क्लिक भी किस तरह का विजन रख रहा है और कैसे आप सब मिलके हम लोगों को हाईलाइट कर सकते हो या हम लोग को सपोर्ट कर सकते हो, मेंटर कर सकते हो, जो आज सुबह से हम लोग डिस्कस कर रहे हैं इसी चीज़ के रिगार्डिंग. सो एक्चुअली हम लोगों ने भी एक पोर्टल बिल्ड किया है जहाँ पे हम MIS डेटाबेस कलेक्ट कर रहे हैं. 2023 में गवर्नमेंट सेंट्रल गवर्नमेंट से एक लेटर इशू हुआ था जो हम लोगों ने थोड़ा सा इनिशिएट किया था सेंट्रल गवर्नमेंट को, जिसमें हमारी ऑर्गेनाइजेशन को हाईलाइट भी किया गया था। तो हमें 13 स्टेट से कॉल्स भी आए थे कि हाँ इस पे कैसे काम करना है, क्योंकि समवेयर गवर्नमेंट को अवेयरनेस नहीं थी कि कैसे काम करना है। इवन यूटी से भी कॉल आया था, अंडमान निकोबार आइलैंड से। तो हमें शौक भी हुआ कि हर जगह केयर लीवर्स हैं और हर जगह गवर्नमेंट भी काम करना चाह रही है, लेकिन शायद अवेयरनेस नहीं है, तो इस वजह से हुआ। जैसे लेटर सर्कुलेट हुआ पूरे पैन इंडिया में, तो लोगों को शायद हाईलाइट्स हुई इस चीज़ को लेकर कि इस पर काम करने की ज़रूरत है। तो
वेरी गुड, and I think we can share that. You can share the link to your portal and we'll ask CSA to share with everybody because we're running out of time. But thank you, बहुत बढ़िया काम कर रहा है।
Thank you so much, ma'am. Yeah.
Shall I take? Okay, while we stand and someone comes and gives those nice pictures, you can speak. Good. Come on, yes.
So I just want to highlight that there are a lot of information, lot of opportunities are there. There are a lot of things, lot of opportunities are there. I just want to highlight this, that we are with the UNICEF and there is beautiful fellowship is going, LEAF fellowship. So we should strengthen that because that fellowship is creating leadership. So my request is to collaborate, more collaboration. Yeah, thank you so much.
So our advocacy director Satyajit Muzumdar is handing over the momentum to all the esteemed guests on the dais. Thank you so much. We have few more minutes to go. I know we are running out of time, but not more than 15 minutes more. Thank you so much. I would like to